Good morning. Morning everyone, again with me Dr Veach and the Deputy Secretary for Health, Dale Webster, as well. First and foremost, I want to provide an update on the current situation with COVID. I do want to start though with some good news. As of today, we have more people who have recovered and have been released from isolation than we actually have positive cases in isolation. In today's update, there are an additional 1,731 people who've recovered and been released back into the community from isolation, which makes a total now of 8,409 people who are now recovered and out of isolation. Till 8 p.m. last night, we had a further 1,201 more cases, which brings us to a total of 7,439 active cases in isolation. So around 1,000 more people have been released from isolation than are currently isolating as positive cases. There are 10 people in hospital being treated specifically for COVID symptoms. Now, importantly, we recognise, as I said yesterday, that this transition period is challenging. Things will get better, and as I said yesterday, this is not living with COVID, this is transitioning to live with COVID. And it's a period that we need to get through to ensure that we can return to a more normal way of life, where COVID becomes a virus that we manage, much the same as we manage a range of other influenzas and respiratory illnesses. I do want to acknowledge all Tasmanians for doing their bit, and I know it's difficult and it's challenging, but again I want to make the call out to Tasmanians. The reason that we had such a good run over 2 years was because in the main Tasmanians reached out their hand to each other and they helped each other. It's important that as we go through this, as difficult as it is, that we continue to step forward with that same attitude, and I'd ask Tasmanians to do so. Our major challenge at the moment is not that our hospital system is being overloaded with COVID cases, it's the isolation requirements that are impacting on close contacts. Now, that's why yesterday we moved to allow businesses who are critical and essential to supply to be able to apply for exemptions for those workers who are close contacts of a positive case, so that they can return to work under strict conditions to keep our essential and critical businesses and supply chains operating. And that will be available for businesses to apply from 12 o'clock today. However, we know that this is challenging for both our community and for businesses. And over the last 2 years, we've delivered nation-leading business and community support to assist with the challenges that we've had to face with COVID. We've retained a strong COVID funding provision in the budget to provide us the flexibility so that we could pivot and respond when we need to. And we believe that there's a need to provide some further support. We've already put in place individual financial support for workers who have to get a test or isolate as either a positive case or a close contact, and they can access either the Pandemic Leave Disaster Payment through the federal government or Tasmanian Government's Pandemic Isolation Assistance Grant. However, we recognise it's important to provide further targeted support to the community and to businesses during this transitional time. Today, what I want to announce are additional targeted support measures through the Business Impact Support Program and what we're calling the COVID Care Program. The Business Impact Support Program has been designed to help those Tasmanian small businesses which have had a reduction in business turnover due to COVID cases and isolation requirements. It will cover initially the period from the 15th of December when we open through to the 14th of January. The downturn for those businesses may have been caused by loss of staff due to exposure that has affected the business's ability to operate, or loss of business as well due to significantly lower than usual customer demand. Funding of up to $5,000 will be available to eligible businesses depending on their business size, and support of up to $5,000 will also be available for those businesses that experience an unavoidable loss due to spoilage of perishable goods because they had ordered and they weren't able to get those goods out the door. To be eligible, businesses must have met their obligations to have a COVID safety plan and a completed risk assessment in place, and where required, a COVID case outbreak management plan, and importantly have been using the Check-in TAS app. So basically a business needs to demonstrate that it has done the things that have been required of it as we worked our way through this period. Now for businesses, the benchmark will be a 30% reduction in turnover, which is what we've used in the past, and it will be comparing this period this year to the similar period last year when we were broadly open, and in fact most businesses were reporting that they'd had a pretty reasonable trading period over the December and early January period. Now the guidelines for the Business Impact Support Program will be available on Monday, and the program will open on next Wednesday for applications. And importantly, we want to ensure that we get money out the door as quickly as possible to these businesses. Now, as I've said, just in terms of further eligibility, the businesses obviously must be located in Tasmania, and they must meet that eligibility criteria that I've indicated. To find out more, they can visit the Business Tasmania website later today, or by contacting Business Tasmania on 1800 440 026. And as I've said, the full guidelines will be available from Monday as we move forward. In addition, there have been a number of major events that have been held through that period. By major events, we're talking about those that have been registered for more than 1,000 people attending. The Tasters one, the Devonport Cup is another one that springs to mind. They needed to have been registered under the events framework, and they needed to have been events that were going to operate or operated from the 15th of December through to the 15th of January. If they've been financially impacted by COVID-19, they're encouraged to contact Business Tasmania to register that impact, and targeted financial assistance will be considered on a case-by-case basis. We're not in the business of making these events profitable, but what we want to ensure is that businesses aren't placed into a loss situation as a result of a lack of patronage, or because there were COVID cases or exposures that impacted that particular event. Now, I think from the advice that I've received, there's somewhere between somewhere up to around 20 events that were registered through that period. Now, obviously, if an event decided not to go ahead and was able to manage its financial position through that, then as I said, we're not in the business of making businesses profitable. For those that worked their way through and were impacted, we'll work with each of them on an individual basis. Now, in terms of the business support program, I'm viewing this as tranche one. If we need to, we will continue to roll out supports, and we'll review this again in early February, and again make an assessment as to whether or not there's a requirement for further support required. I also want to discuss support for the broader community. Now, additional funding is going to be provided to care for those in need around the state as we work through this current situation, and to ensure continuity of services for our vital community sector organisations. The community care package will build on the ongoing community and supports that have been put in place since the start of the pandemic in 2020, and which includes $32 million worth of funding specifically that's already in this year's budget. But it'll build on those funding and supports already in place, including emergency food relief, emergency housing, family violence flexible support packages, and the COVID care package will ensure that those that need additional support because they need to isolate, because they're a positive case or a close contact, or are caring for someone with COVID, to ensure that they have access to the everyday basics of food, medicines, accommodation, rapid antigen tests and PPE if required. The service, there's an ongoing one at the moment, and it'll build on that, will continue to be provided by the Salvation Army and its many local community partners. It will be a 7-day-a-week service. Funding support for this will be uncapped. In addition, we're providing, and as part of this funding, there'll be extra funding provided to TASCOS directly, so that they can provide grants of up to $4,000 to provide assistance to their broad network of community service organisations. And I do want to thank TASCOS. Over the last 2 years, they have worked very closely with government. They have been nimble, they have pivoted when they've needed to, and they've been able to support those organisations well. But there'll be grants available up to $4,000 for their network of community service organisations to ensure continuity of day-to-day services for essential community service workers and volunteers, including the purchase of RATs, masks, other PPE if required. Communities Tasmania will also provide additional masks, sanitiser and other supports for those most vulnerable people, including those living with a disability or other underlying health conditions. Importantly, support directly, but also to those who support them, their carers, as well as Tasmanians, as I've said, that have got other underlying medical conditions. Specifically, support available will include access to the free delivery of food and everyday basics, and by that, these are where people are being forced to, as a result of a direction, to isolate because they're either a positive case or they're a contact of a case. So the delivery of food and everyday basics, we will assist them to receive their medicines and pharmaceuticals, should they not be able to leave to receive them. There'll be additional accommodation that will be provided. We already provide significant accommodation options through uncapped brokerage for people that we might need to provide support for in hotels or self-contained accommodation, and also the safe spaces that we have, safe night spaces that we have, will provide additional support. One of the options there will be that we have additional capacity available within our quarantine hotel system if we need to support people that can't or are unable to manage themselves at home through these periods. As I've indicated, face masks and sanitiser to those that need additional support, and including, as I've said, rapid antigen tests for those who are symptomatic or a close contact, as announced yesterday, will be directly couriered to them if they live in remote or regional communities, or where someone is unable to leave home due to a lack of transport or because of a disability or other health concern. We will make certain that we can courier those rats to them. We're also going to provide ongoing support for businesses to access the broad range of advice from the TCCI, who've been running a hotline in terms of providing support, and this will include how to support employees who have a high risk from complications from COVID. They could be because they have a disability or they are immunocompromised or have some other underlying health condition, but to assist them and provide them with advice in terms of how best to work with that employee, and importantly, if there are work from home options that need to be considered. Tasmanians living with a disability also, and they currently are and will continue to be, prioritised in our state-run clinics for vaccinations, with support people encouraged and welcome to attend vaccination appointments with their clients. This support is on top of the Disability Hub clinics that are being managed and rolled out by the Commonwealth and in reach for group home settings as well. And so we want to ensure, and Dale is well practiced at the supports that we provide for that sector, and to ensure that we continue that and people are well aware that it's available. We're also putting in place a dedicated contact point for people with a disability who want help with issues like responding to cases, identifying close contacts, as well as ensuring access to PPE supplies, and that will be available through the COVID helpline, and then we'll have a dedicated resource that will be able to provide that ongoing information. Now, the government recognises, as I've said, that not everybody has family or friends to assist them whilst isolating. And so I'd again ask Tasmanians, if you're aware of someone that is isolating, a family member, a neighbour, a friend, reach out to them if you know their phone number. You can knock on their door if you know that they're isolating, and make certain that you stand back and ask them the question, do they need some support? We want to make certain that as a community we support each other as we work our way through it. Now, Tasmanians, individuals or families, are able to access these additional supports by ringing the Public Health Hotline on 1800 671 738. COVID care will be provided on request to those in need in a flexible, individualised response. And so if you need to reach out and you need somebody to go and get your script and deliver it, if you need food or other supports, then that will be available to you as we work our way through it. But I do want to start where I finish where I began, and that is that, importantly, we are not through this yet by any. Well, there is no doubt that we have a fair way to go as we work our way through this. But over coming weeks and months, importantly, If we continue to work through this transition stage together, and as we've seen in today's numbers, with 1,731 people leaving isolation, in fact more coming out than going in, if we work together we will get through this. This transition phase is the difficult bit. We've got to get through this and our life will return more to normal, where we can manage COVID more like one of the normal respiratory or influenza type illnesses that we deal with every year. I'll hand over to Dr. Veach for further information.
Thank you, Premier, and good morning. I'd be pleased to take questions.
The Premier just pointed out some nuances in the COVID numbers, pointing to the fact that now there's more people out about who have recovered from COVID than we have of active cases. But how reliable are those numbers now when we know that, I suppose, asymptomatic people aren't eligible for free COVID or RAT tests and can't access them? I mean, do those numbers actually give us a true picture of the COVID situation in Tasmania?
We have to look at a range of measures to get a good sense of what's going on in the COVID, with COVID in Tasmania. The Premier noted that case numbers have actually been, of new case diagnoses have been pretty stable between about 1,100 and 1,400 for about 5 days, with a mixture of rapid antigen and PCR-based tests. And that's been fairly stable after it increased quite rapidly to that level. The fact that it hasn't gone up much higher is, I think, good news. However, the proportion of PCR tests that are positive is still sitting at around 20 to 30%, which is another indicator that there's a fair amount of COVID out there. The other thing that we see is the hospitalisation rates. And the hospitalisation rates increased earlier this week, but have been stable a bit over 20 for the last 2 or 3 days. So we're not seeing further increases in hospitalisation. Our hospitalisation rate per capita is amongst the lowest in the country. It's fairly similar to the ACTs, and our overall rate of COVID is similar to most states except for West Australia, that's much lower, and Victoria and New South Wales is much higher. So you really have to look at a whole lot of things, and it suggests to me that we're partway through the upward slope of COVID. We might be hitting a bit of a plateau. I couldn't tell you with confidence whether it will go down or whether it will go up again in the coming days. The best thing to predict what happens with COVID is to look at what happened over the last couple of days, because that's what's probably going to happen over the next couple of days. So I would probably expect the most likely thing is that we continue to diagnose between 1,000 and 1,500 cases of COVID a day on average for the next few days. But I also wouldn't be surprised if it goes up. But I'll be particularly looking at whether or not our hospitalisation rate remains stable or increases, because that's probably the most important measure of COVID impacting the community.
Is there still no known transmission in those healthcare settings, or are you seeing transmission there now?
I have to defer that question to Dale Webster on the matter of healthcare setting cases. We do know that the vast majority of transmission is probably occurring in the community and in households, because that's the setting where people are most likely to get infected.
The Premier's mentioned a few times, we're in a transition phase, but, how long could that last for? Is that something that could be months?
It's usual that waves of Omicron, when they occur around the world or have occurred in Australian states, last for up to 2 or 3, sometimes a bit longer, months. But what we're dealing with now is the Omicron strain, which is more transmissible. So it's possible that it will be a sharper but perhaps shorter epidemic period than the previous waves, which were mostly Delta and the previous variants of the virus.
How much do you anticipate cases may rise as a result of the ASHES test being held here?
I think it would be very difficult to pick out discrete changes in case numbers due to the ASHES test. We know that on any given day there might be 10,000 people at the ASHES, but there'll be another 530,000 Tasmanians mixing. So I expect the overall contribution to case numbers will be considerably greater from the community than that particular event.
And do you have the latest number on how many Tasmanians are isolating as close contacts?
I don't have that number.
And in terms of the new restrictions to allow close contacts to return to work, will you be encouraging them to limit their movements in the community when they're not at work?
It will be people who are in a select group of industries who are enabled to go to work while in close quarantine while in quarantine as close contacts are subject to a number of conditions. They have to have a rapid antigen test before they commence that return to work. They have to have a rapid antigen test every day while they continue at work. They must wear masks at work, and they certainly must absent themselves when they if they have any symptoms, and they must avoid any situations where they could be unmasked with other people, such as lunch breaks and the like. But they are required to return home to their quarantine circumstances at the end of their day. So it's not permissible for them to stop off at the grocer's on the way home. They must go directly from home to work. It's part of their conditions.
Would you expect to see an upswing in transmission as a result of the changes to those close contact isolation rules for those specified workers? There's obviously a lot of measures in place to protect, but would you still expect that there will be a bit of an upswing in transmission?
I don't believe that the measures we're making are likely to create a substantial, that we're enabling, are likely to create a difference in community-wide transmission. There's a lot of transmission occurring across the Tasmanian community already. There are several thousand transmission events every day in Tasmania. There has to be, for the number of cases we're seeing. We're actually providing this provision to a select number of people in selected people in selected industries, and there are mitigations in place. So the workplaces do have a pretty serious responsibility to make sure that the workers comply with the requirements that I just outlined, to make sure that there's no within the workplace transmission. So I wouldn't expect that as a major contributor to ongoing transmission, but it's an important thing that we enable this to occur, because the function that these people will be maintaining is critical for our supply and services in our community.
Can I just ask one quick question? I'll just check. Yesterday you said, I think you believe there were 2 or 3 children who were hospitalised due to COVID. Has that changed, or what's the number now?
I've had a chat with our team with the view to actually being able to provide, perhaps once a week, a short summary of the age range of people who are hospitalised with COVID. I think it is in the public interest to actually have a broad sense of the age range of people who are hospitalised with COVID. It gives you an idea of where the impact is in society of more serious COVID, and it also can remind people, if they're in particular age groups, precautions, vaccination and so on. It's a little bit, as people would know, I'm always hesitant to give out detailed information in small age brackets or locations for fear of people feeling identified, but I'm working with the epidemiology team to see if we can provide a summary that provides an overview of that information, probably once a week.
Thank you, Dr. Beach. Before taking questions, just a short statement from me. From this morning, the North West Regional Hospital is reviewing some of its services due to the impacts on staffing of COVID-19. They'll be moving to a variation of level 3 escalation at the North West Regional Hospital. This will ensure continuity of inpatient and emergency medical care. More than 90 staff are currently unable to work due to community-acquired COVID-19 infection or being identified as close contacts. There has been no transmission of COVID-19 reported in the North West Regional Hospital. But coupled with the effects of ongoing need for staff to take leave and the traditional holiday period, we think it's time to move the North West Regional Hospital to that escalated stage. The North West Regional Hospital will ensure business continuity can be maintained. This will mean that they will review areas ongoing in line with their escalation plan, with local communications from the Regional Health Commander, who is also the Executive Director of Medical Services at the North West Regional Hospital. Outpatient and elective surgery activity will be reduced, with outpatient services for urgent and Category 1 patients to be moved to telehealth over the coming days. The hospital is implementing strategies to increase workforce capacity, including staff being asked to reconsider leave arrangements and also exemptions in line with the public health order. These measures are being implemented at the North West Regional Hospital site only. It doesn't affect the balance of the North West region, so it doesn't apply to the other facilities. While the North West Regional Hospital is maintaining restrictions on unvaccinated visitors, there are no further formal visitor restrictions at this time. But, however, we also ask people to only visit the hospital if necessary. A staff testing clinic has already been established, and this will continue. Testing of patients admitted overnight to the North West Regional Hospital is also occurring. While we understand that these changes can cause concern amongst staff and the community, we're taking steps to responsibly manage the impact of COVID-19 on the hospital, including the staffing levels, so that we can maintain the core functions and continue particularly the emergency care functions of the hospital. These measures have been introduced as part of our preparations for a likely increase in COVID-19 cases in the community. I'd like to acknowledge the efforts and dedication of all the staff of the Tasmanian Health Service, particularly in the North West. I'm confident that as a workforce it will again meet the challenges that this pandemic presents and continue to offer the best healthcare to all Tasmanians. Take questions.
I was going to say, would there be any possibility of reconsidering, I suppose, rehiring staff who were let go because of being unvaccinated to work in, say, the North West Regional Hospital when you've got workforce constraints there?
The reason why unvaccinated staff, the mandate for vaccination among staff was introduced was it is actually a protection against the spread of COVID, and we've encouraged every Tasmanian to get vaccinated as that protection. So that is not one of our considerations at this time.
Do you maintain that there is no known transmission happening in hospitals?
My advice from all of the regional health commanders and the THS commander, who's the Chief Medical Officer, is there are no known transmissions within our hospitals.
Do you have a figure though on the amount of healthcare workers that are currently COVID positive?
Yes, so across Tasmania there are 188 healthcare workers who are COVID positive, and that includes staff that are not directly in the hospitals.
Is there an update as well on when the case management facility in the North West will be opened?
The Wellers Case Management facility in the North West was subject to the significant rain event last Friday, and in fact, so we're undertaking repairs to the roof. So once those repairs are completed, we'll be in a position to actually open that case management facility, and of course it will only open if we have cases to put there.
Do you anticipate that there'll be enough staff to run that facility given some workers being off at the moment?
Capacity to staff the health system is a daily challenge during a pandemic, but we are confident that the services that we need to run can be run, and as I've just outlined in the North West Regional Hospital situation, we're focusing on inpatient services and emergency care, and we are moving our staff around to do that. So again, if we need to staff a case management facility, we will look around and move our staff into the right position.
What impact do you expect this will have, the measures at the hospital, in terms of the escalation to level 3? What impact will this have on elective surgery waiting times?
Look, elective surgery will be reduced at the North West Regional Hospital. That, of course, will have an impact. However, we will work as we have throughout the last 6 months, our elective surgery plan, which will take into account this change, and we will work as soon as we've got the staff back on deck to work through and implement our plan, our ongoing implementation of our elective surgery plan.
You just mentioned that there are 188 healthcare staff who are COVID positive. Does that include paramedics, or is there a separate figure for that?
Look, that number at the moment includes paramedics, but I don't have a breakdown of where each group is.
Have all those patients who are due to have elective surgeries and may be impacted by the reduction in services been notified? And if not, when will they?
So we'll be doing that today as we move through the escalation. So the approval to move to escalation level 3 and reduce services occurred last evening, and the staff of the North West Regional Hospital are now working through the plan to achieve the outcome.
Any questions for the Premier, guys?
Premier, just the business support package that you've just announced, that first tranche, will that include any specific support or any extra support for businesses on King Island, or will they just come under the, I suppose, the same grant amounts and the same category as the rest of Tasmania?
Look, they'll fall under the under this package.
And the $5,000 amount, how was that arrived at? Is that going to be enough to help the businesses affected?
Well, in terms of the impact of this period of time since the reopening, broadly what we understand, the evidence appears to be that most businesses traded reasonably well up until around the Christmas period. Some may have been impacted a little earlier, which is why we've gone from the starting date of the reopening. But in the main, we expect most businesses that will have had a reasonable run up to Christmas. And then obviously as case numbers started to mount and people became more concerned, then we started to see people stepping back and managing their behaviours and not going out and spending as much. So the 5,000 has been targeted for this period over really the last 4 weeks, but predominantly the last few weeks. Now, as I've said, if we need to do more, we will do more. We're not in the business of making businesses profitable. We're not in the business of replacing a business's entire turnover. What we want to do is to ensure that we provide some supports to assist them through this, and grants of up to 5,000. Obviously, we will start on a similar sliding scale to what previous businesses have. So if you're a small business turning over between $25,000 and $50,000 a year, you can apply for a $1,000 grant. If you've got spoilage, you could apply for food spoilage as well, and then that'll cascade upwards in terms of the other businesses. But
for this, or is it uncapped this first tranche?
look, we'd expect this, and again, it'll be based on the feedback that we're getting. We think that it'll be somewhere between 10 to 15 million in total, and that's including the COVID care arrangements that I've announced this morning as well.
Do you think the government's committed to measures it doesn't have the staff for, like the North West Case Management Facility?
No, I don't. And to be honest, in terms of if we needed to have a COVID case management facility on the Northwest, we have the Edgewater available, already stood up as a quarantine hotel, which could assist in that regard. We also have significant capacity across the state in terms of our COVID case management facilities. They aren't full by any stretch of the imagination. So I believe that we're in a good position in that regard.
You mentioned before some more support for Tasmanians living with a disability. When can we expect the government's plan for students with a disability returning to school to be released?
As I said yesterday, and Dr. Veach also mentioned, we're in the process of finalising the return to school plan. We'll discuss that at National Cabinet next week, and I'll have more to say, I'd expect, by the end of next week, in terms of the supports that we would have for individual students with a disability, what their care plans might be, what the arrangements that will be put in place. But parents can be assured, we will step through this very carefully, and we will put in place a sensible and responsible plan. Again, noting though that in terms of the impact of the pandemic over the last 2 years, one thing that I think we are all well aware of, that this disease, even the previous strains, which were certainly much more severe than Omicron, is generally very mild in most children.
Support for major events. Are stallholders captured in that?
What we intend to do is to work with the organisers of those events, and then any support that might need to flow onto stallholders would be as part of a broader package. It's an interesting one. You look at, say, a race day, and you might have a particular business that might be offering some form of food truck at that has suffered a significant loss because of lack of people attending. We know that there were some concerns that were raised at the Taste in terms of some businesses that were reporting they were doing very well, but others in other parts of the Taste of Summer arrangements reported that they hadn't done well. So what we'll do is work with each event to ensure that where support's provided, it can be provided. The other point I'd make in terms of stall holders is that many of those that operate at these major events also have an ongoing business that they operate. If you're running some form of food truck, it's not just the event that you would be operating at, you'd be operating more widely. You may have seen more than a 30% reduction in your overall turnover for that period of 4 weeks, including that event, and you can still apply for the support through the business package that I've announced today.
Are you looking at extending that support outside of that 4-week period?
Sorry?
Are you looking at extending that support outside of that 4-week period?
Look, as I said, I view this as tranche one. What we'll do is in February, we'll review how this program has worked, whether or not there's a need for any additional support. But the point I would make, I think that Tasmanians, albeit still being very COVID cautious, are returning. I've spent time walking around this city, and I see people that are out and about and in greater numbers than what they were, perhaps a week or 10 days ago. Now, as we work through this transitional period, people will gain a better understanding of how they can manage their own personal behaviours and still go about their lives as relatively normal.
Do we have enough tests for those businesses where the isolation rules are relaxed so that they are able to do the runs as they need, as Dr. Beach mentioned?
Yes, and in fact what we said yesterday was that we'll provide a supply over the next 2 weeks, so the government will provide those free of cost. But for businesses, and I'd make this point, when they're bringing back a worker and we've put in place a daily RAT testing arrangement for a critical worker to come back, it may be that you're on day 2 or 3 of your isolation period. You only need the RAT supply for the remaining days in that particular business. So not every business is going to require 7 RATs for each individual worker, and if you are a close contact, you should have already been to one of our distribution centres and collected 2 RATs, one for day 1 and one for day 6 already. So the exposure for businesses in terms of the numbers of RATs should be lower than what they would first imagine. But importantly, we have enough supply to provide them for that next 2 weeks, and we expect that supplies will come on into the private sector through other outlets over that period as well.
Labor is saying that the fact that the government has changed its plans for the road it leads to include not demolishing houses there means they should do the same for the planned extra lane for the southern outlet. Is it possible the government would reconsider plans that might require demolishing homes in Turnern for that?
Look, I've heard some of the concerns this morning, and I'd expect that we'd put a statement out later today on that. But my understanding is that based on waiting on the final engineering advice, that it would only be up to possibly 4 properties that will be impacted. And I know that there have been, over the last 6 to 9 months, it's been discussed, 15, 17 properties at different stages. The actual impact will only be up to 4 properties, and that's what's expected, but as I say, we're just waiting on final engineering advice.
Just on the ashes, what will be, or what do you believe will be the measure of success that would allow you to tell Cricket Tasmania, look at how this went, give us the ashes again?
Well, I think the first thing is the Australian team better win. I think that's always a good first step, and I'm certain that based on performance to date, they are, if you're a betting person, you'd be putting your money on Australia. Look, with an event like this, we saw in Queensland where they had some problems in terms of the temporary generators that they had put in place. It's those sorts of infrastructure and other requirements that I think will be judged on by Cricket Australia. But importantly, I'm very confident that we've taken every step, and in terms of the team that's been working on this, I believe we're in a very good place to run a very successful test. And importantly, I would note that there have been some commentary in the past that people won't turn up for test matches in Tasmania. Now, I expect that some may decide not to attend, but at last count, the first 3 days were absolute sellouts. I know that the 4th day is been also very well received as well, and the 5th day, my understanding is that and I hope Tasmanians will turn up, is that they can enter by and make a donation for Headspace in Devonport as well, which I think will be, again, might encourage some people to come along to support that organisation.
What's your message?
Sorry?
Will you be heading along?
Absolutely. I'll be going along in a very COVID-safe way, as I expect people to wear their masks and be sensible as we enjoy what is, without doubt, the biggest sporting spectacle that has ever arrived in this state. For a test match, especially an Ashes test match, to be here in Tasmania, I think is a rare opportunity, and importantly, as I said yesterday, on the screens of cricket-loving nations around the world for 7 to 8 hours every day will be the very best of Tasmania, and I think that we will hold our own without doubt.
What's your message to people who don't understand why you support the cricket, but music festivals are few and far between?
Well, in terms of music festivals, we have supported them, and my understanding is, in terms of live music, that over the course of the period of the pandemic, we've put in somewhere between $12 and $18 million worth of support to support the live music and arts sector. So there's plenty of support, but again, a music festival is quite different to a cricket match that has seated ticketing, that has mask wearing and other COVID-safe behaviours in place. But notwithstanding that, I would hope that people can get their music festivals up, and I would encourage people to go to them, but do it in a COVID-safe way.
Queensland is scrapping the requirement for rapid antigen tests to enter that state. When will Tasmania consider that?
Look, I'm currently taking that under advisement at the moment. I'd expect that we'll do some further work on that early next week, and then we'll have something to say moving forward. Importantly, the testing remains in place, and obviously, I'd expect that we might see a few more people in the state over the course of this weekend in terms of the Ashes, and I think that it's important that that rapid antigen test still remain in place in those other jurisdictions for people that are entering the state.
Just to clarify, that funding to support events, is that capped at $5,000 or is that uncapped? And does that come out of that $300 million support fund you've got? If so, how much of that remains?
Okay, well, look, that's a broad question, because in terms of the COVID fund that we introduced in the budget, that was $150 million this financial year, and then over the course of the forward estimates, and obviously we're in a position where if we need to, we can bring that forward, subject to taking forward a supplementary appropriation bill later this year if need be. But look, I'd have to get you a look for the number on that broader $150 million. In terms of the events funding that was announced by the Minister earlier in the week, that's $5,000 per event that they can apply for to assist them to run those events. Thank you.